Welcome to another episode of AI in Healthcare, how digital transformation is happening in the field of healthcare. Today, we are diving into some key terms that explain how AI and more specifically, generative AI tools like ChatGPT are shaping the future of medicine and healthcare delivery. As AI becomes more embedded in clinical practice, understanding how these systems function is crucial. Let us break it down in simple terms. Number one, prompts. What is it? What is a prompt? A prompt is the input you provide to an AI system. It is a question or a task you give to start the conversation. In healthcare, these prompts could be as simple as suggest treatment options for a diabetic patient or summarize the patient's medical history. So this is like the order or the request that you give it to your secretary or the assistant. What should be done? For example, if you type what is the best treatment for migraine, that's your prompt. So the more elaborate your prompt is, the more descriptive your prompt is, the more useful the output will be. Number two is temperature. Temperature in generative AI. What is temperature? Temperature controls how creative or conservative the artificial intelligence response will be. In healthcare, a low temperature setting is useful when you want a more focused evidence-based answer. This temperature, mind you, it's not the usual temperature. A high temperature could be helpful in brainstorming novel solutions or treatment approaches. I'll give you an example. When you put the temperature at low, for example, 0.2, the response will be more predictable and clinical. Whereas if you put the temperature at 0.8, the response might be more varied and creative. So you want a very creative response, which is not the thing which you want in healthcare, then you have to put it at a higher temperature. Where you want very specific clinical and response which is accurate, then you put the temperature low. For example, I'll give you an example. If you ask for a treatment plan at a low temperature, the AI will likely suggest standard, well-researched therapies. At a high temperature, it might include more experimental or holistic approach, or it might even hallucinate. I'll come to that next. So always for an healthcare application, keep the temperature low. That is the temperature has to be kept at a lower level. Number three, tokens. What is a token? Tokens are how AI systems like ChatGPT process text. Each word or sometimes part of a word is a token. In healthcare, managing tokens efficiently ensures that large amount of medical data, such as patient histories or diagnostic results, can be processed accurately. The length of both your input and the AI's response are measured in tokens. I'll give you an example. In the sentence, the patient is experiencing chest pain, there are likely about 6 tokens. Managing these helps ensure that the detailed medical records can be handled efficiently. Number 4, which is the most important thing which everybody should be aware of. What is a hallucination? In AI, hallucination happens when the system generates information that sounds plausible, but it is completely inaccurate or fabricated. In healthcare, preventing hallucinations is critical to avoid misinformation. For example, if ChatGPT suggests an unapproved drug or invents a medical condition, that would be a hallucination. It's why human oversight in AI-driven healthcare is crucial. Putting it all together with an example, let's see how these concepts come together when applied in a healthcare context. I'll tell you prompt. You might ask ChatGPT, summarize the treatment plan for a hypertension. I am an experienced cardiologist, so this has to be from the level of a cardiologist. Temperature, you set the temperature to 0.3 to ensure that it's a more conservative, evidence-based response. Tokens, the model processes your input, and if the response contains 150 words, that might use around 200 tokens. Hallucination, if ChatGPT suggests an outdated or unapproved treatment, it is essential that healthcare professionals cross-check it and verify this information. In summary, artificial intelligence is already transforming healthcare by streamlining processes, improving diagnosis, and enhancing patient care. However, understanding these key terms help us better grasp the technology and apply it responsibly. Thank you for watching, and please stay tuned for more insights into the future of AI in healthcare. Please share your thoughts, suggestions, and comments. Thank you, and see you again next time with another video.